To Hope Harbor Counseling, and congratulations on reaching the next part of your counseling education program. So whether you are a student looking for a practicum site to do your practicum, or you're a graduate and you're now working on your LPC intern hours, I look forward to getting to know you in the process, and maybe we meet up for your supervision needs. My name is Dawn Irons, and I'm the Clinical Director at Hope Harbor Counseling in Denver City, Texas. My educational training is I'm currently a PhD student at Walden University, working in their Counseling, Education, and Supervision department. I received my master's degree in counseling from Dallas Baptist University. And my bachelor's degree was in social work from the University of Mary Hardin-Baylor. My clinical experience began in my undergraduate internship at Mary Hardin-Baylor, where I was working with Family Outreach of America, which was a subsidiary company that contracted with Child Protective Services. We would go into residential treatment centers and teach parenting classes to parents that had had their children removed, and we were working towards family reunification. My next round of experience came through my practicum as a master's student, where I worked at Soul Care Counseling and Close Solutions Counseling, which were both private practices where I was gathering just more hours in different types of counseling settings. I also worked at the Mid-Cities Pregnancy Center. We worked with a lot of crisis situations there and worked also with post-abortion trauma counseling. I then went on to work with chemical addiction intensive outpatient programs at the Springwood Behavioral Health Hospital. And then finally, in 2013, I opened my private practice where I began to specialize in EMDR therapy. On this slide, we will go over my specialized training and professional membership. I am a level 1 and 2 certified EMDR therapist through EMDRIA, which is the EMDR International Association. I have further training in Stewards of Children, which is an abuse and prevention detection for child sexual abuse. I have training in suicide prevention, intervention, and postvention through the International Critical Incident Stress Foundation. Certified in treatment and diagnosis of sexual addictions. Certified in addiction and recovery. Certified in the Nathan Project, which is for sexual integrity and ministry and counseling. I do that with a lot of the churches and nonprofit areas in their counseling and staffing situations. I'm certified with Prepare Enrich as a trainer and facilitator. And I have memberships with the American Association of Christian Counselors and Christian Counselors of Texas. My prior supervision experience and training comes from being a site supervisor for practicum students at counseling programs in the Dallas and Fort Worth surrounding areas. And I have a doctoral level training in clinical supervision at Walden University. I am currently the private practice clinical director at Hope Harbor Counseling in Denver City, Texas. I am available to work with master's level practicum students as well as LPC interns with provisional licenses from the state who are working towards their 3,000 hours for LPC licensing in Texas. I am also able to serve as a practicum site for master's or doctoral level counseling students. My supervision philosophy and approach comes from two different models, and I kind of integrate them together. I will be using the reflective developmental model And this is based on when you experience a triggering event or some kind of discomfort or uncertainty in your clinical experience, you'll bring that into supervision. And we will reflect on your internal processes about what happened, how you were feeling about it as a counselor. Was there transference, countertransference? But that internal reflecting on your process will help shed light on how you might do things differently in the future. As I combine that reflective model with the discrimination model, which focuses on the supervision focuses on three primary stages: your interventions, your case conceptualizations, and your personalization of how you make your theory your own. And then as a supervisor, I will serve in the fluid roles of teacher, counselor, or consultant based on your needs. As you gain more independence and self-efficacy, I will transition more to the role of a consultant. When considering the fees for supervision, if you're at the graduate practicum student level, there are no fees for supervision. If you're an LPC intern working on your state required hours, the supervision fees are $250 a month, and they will be due on the first weekly session of supervision each month. Expectations for you as a supervisee: you are expected to come to supervision ready to participate and discuss your professional processes and grow through the experience of seeing clients. This will include your case conceptualization and treatment plans for your clients. You will need to bring samples of your clinical work, possibly a 10-minute video clip from one of your sessions. You are expected to participate in supervision with the goal of increasing your clinical competency and maintaining the integrity of the LPC Board Code of Ethics. You are to advocate for yourself and request what you need regarding supervision, including ongoing evaluations. If you have a problem with me, please feel free to come and talk with me. My goal is to always foster a relationship built on trust and respect. Please do not let frustrations fester. Be assertive and respectful, but come speak to me. You are expected to be knowledgeable about and counsel according to the Texas Counselor Code of Ethics. As a professional, you are expected to remain teachable and open to feedback, which is the purpose of supervision. What you can expect from me as a supervisor. It is my responsibility as an LPC supervisor to maintain my license credentials for supervision and to teach and train you in a professional counseling practice according to the Professional Code of Ethics and the Texas Board of Counseling Examiners rules and regulations. You can expect me to train and evaluate your clinical skills and provide appropriate feedback and oversight in the use of your chosen theory, case conceptualization, and treatment planning for your clients. You can expect to come to me with problems and mistakes and be coached and encouraged on how to correct those mistakes. If I find that you have problematic skills and behavior, my goal is to create a professional development plan with you to work on remediation of those problems. My goal is your success. I will work with you to correct issues as they arise, but it is imperative for you to be honest about your concerns. Furthermore, if I have concerns about your performance, I will bring those concerns to you privately and respect you by not addressing them in a group supervision session. Depending on the severity of the problem and ethical concerns, I may need to report these issues to a faculty supervisor or the Board of Counseling Examiners, but only after I have spoken with you first and given you every opportunity for remediation. I will be evaluating your clinical skills by videotape sessions. You will need to find clients who are willing to be recorded for your educational growth and have them sign consent forms to be videotaped. Twice a month, you will bring a 10-minute clip of one of your sessions for which you would like feedback. Bring a good sampling of your mistakes as well as your best work. Remember, it's a positive sign of growth when you can recognize your own mistakes or misgivings and bring them to me for feedback. I will further observe your teachability and receptivity to feedback. Am I a good fit for your supervision needs? If you decide that I am, give me a call so that we can make an appointment for an interview and get to know one another. Supervision is a relationship built on trust and mutual respect as professionals. My phone number and contact information is at the bottom of this slide. Consider your options, and if you think we're a good fit, let's talk.